Welcome to Vet Review. In this video, we are going to talk about internal structure of the heart. Okay, so this is the part 2 of the video, anatomy of heart. And in this video, we are going to discuss the right atrium. Okay, because from an exam point of view, right atrium is very, very important because it has a lot of structures. Okay, so let us start with what is the right atrium and what does it do. So it is a thin-walled muscular chamber which receives the venous blood from the body. So this is just a rudimentary structure of the heart, and we have 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Always remember that the ventricles have a thick wall, so their function is to pump the blood, while the atrium, they receive the blood. Okay, so the deoxygenated blood from the body will come into the right atrium. Okay, then the right ventricle will receive this blood and supply it to the lungs. Okay, so this is all deoxygenated blood. Then oxygenated blood from the lungs will be received by the left atrium. Okay, so both atrium, they are just receiving the blood, and then the blood will go to the left ventricle and it will pump the blood to the body via the aorta. Okay, so this is the way you can remember them. Then it is placed at the anterior portion of the base of heart and is related to the left atrium medially and right ventricle ventrally. Then it receives cranial vena cava at the level of the 4th rib. Very, very important points. Cranial vena cava, 4th rib. Caudal vena cava at the level of the 5th rib. Then it has 2 parts: sinus minorum, which is the main part, and then atrium proper, which is also called as the appendix. So appendix is the muscular portion, and sinus minorum is just a thin-walled pouch which will receive the blood. Okay, so sinus minorum is placed posteriorly and it acts as the receiving portion, as I just said. And it has the following openings. The name of the openings is very, very important. Whenever the question will come in your exams to describe the internal anatomy of right atrium, you have to mention the openings. Okay, and make sure that you are mentioning all the openings. Okay, so we have cranial vena cava. It is present at the upper part of the sinus minorum. Then we have caudal vena cava, which is at the lower portion. Okay, caudal vena cava is guarded by a valve called eustachian valve. It is located in the superior portion of the caudal vena cava and protrudes into the right atrial cavity. And in between these two openings, to the cranial and caudal vena cava, there's a structure called intervenous tubercle. So we have opening to the cranial vena cava, caudal vena cava, and then in between them there's the intervenous tubercle. And why this structure is important? It is very, very important structure. Why? Because it is the location of the sinoatrial node, the pacemaker of the heart. And what is the function? It directs the blood from the cranial vena cava towards the atrioventricular septum. Okay, it is just a small projection from the posterior wall of the right atrium of the fossa ovalis. So what is fossa ovalis? See here. Fossa ovalis is just a remnant of the fetal heart. It is a depression present cranially to the opening of caudal vena cava at the superior aspect of the interatrial septum. So the right and left atrium, they are separated by an interatrial septum. Okay, in fetal life, they are not completely separated. Okay, there's a hole in the interatrial septum, and this is called the foramen ovalis. Okay, and this foramen ovalis closes at the birth. Okay, and this is called fossa ovalis. So whenever someone says कि बच्चे के दिल में छेद हो गया या छेद था, तो छेद पहले से ही होता है, बंद नहीं हो पाया. Okay, so this छेद is foramen ovalis, and when it closes, it forms the fossa ovalis. The margin of the fossa ovalis is called limbus fossa ovalis. Then opening of the coronary sinus, it is guarded by Thebetian valve. Don't get confused between eustachian and Thebetian valve. Eustachian valve is associated with caudal vena cava. Thebetian valve is associated with coronary sinus. Then vena hemiazygos, it opens below the opening of the posterior vena cava, very close to the coronary sinus. Then close to the septal wall, there are some minute opening to small veins of the heart. Okay, so small minime, veins, venae, heart, cordis. So venae, cordis, minime. They are also called as Thebetian veins, and we also have an anterior cardiac vein. So it is a big vein. And the venae cordae minime, they are very, very small veins. You're not going to appreciate them very easily. Okay, then appendix, as I said, it is a muscular pouch on the superior anterior aspect of the right atrium, overlapping with the right side of the aortic root. Okay, just the name is important. Then we have crista terminalis. Okay, crista terminalis, again, very important term. Often it is asked as an objective question in the exam. It is the ridge of myocardium which originates from the interatrial septum. Okay, in front of the caudal vena cava, extends along the posterolateral wall of the right atrium and between the orifices of the cranial and caudal vena cava. Okay, so what is the significance here? Okay, this definition is not the significance. The significance is the comb-like structure, okay, which is formed by this crista terminalis and muscles called as pectinate muscles. Okay, so these lines, they are the pectinate muscles, while this band is crista terminalis. Then we have triangle of Koch. Again, very, very important question. In objective, they will not ask you this structure because, to be very honest, it is kind of a higher level structure, right? Not for very basic anatomy, but the significance is that it is the location of the AV node, atrioventricle node. Okay, and why it is called a triangle? It does not really look like a triangle, but it is surrounded by three structures: the tendon of Todaro. Okay, then we have the septal cusp of the tricuspid valve and opening of the coronary sinus. These three structures, septal cusp of the tricuspid valve, opening of the coronary sinus, and tendon of Todaro, they together form a triangular, or we can say somewhat triangular shaped area called triangle of Koch. And what is tendon of Todaro? It is just a continuation of the eustachian valve and Thibetian valve. Okay, then we have vestibule of the right atrium. It is the outlet portion of the atrium which will lead to the tricuspid valve. So the receiving portion of the atrium was called as sinus minorum. Okay, while the outlet portion, so suppose this is a pipe, okay, like this. Okay, there's one opening here, one opening here. This is the opening for the veins which we just discussed. So the blood will come like this. Okay, so this is the receiving pouch, and one is the supplying pouch which will supply the blood to the ventricle, and this structure is called as the vestibule of the right atrium. Then we have tricuspid valve. Very, very important. Tricuspid valve is present on the right side. Bicuspid valve present on the left side. Okay, so tricuspid valve guards the right atrioventricular orifice, which we call tricuspid orifice. It is made up of three cusps. We have septal cusp, parietal cusp, and angular cusp. So this is all about the anatomy of the right atrium. It is very, very important. Often in the exam, the question will come, describe the external anatomy of the heart and describe in detail the internal anatomy of right atrium or right ventricle. So we'll talk about right ventricle in the next video. I hope you like this video. If so, hit the like button, share this video with your friends, and subscribe to my channel. Thank you.